Hey guys, so in this PowerPoint, we're going to be talking about the fitness assessment, mainly chapter 6 in the book. Okay, and hopefully my daughter lasts for all of these 73 slides. All right. So I skipped over some of these purpose and introduction stuff just to get it out of the way. But the fitness assessment is really, really important to kind of find any issues, problems, either with a Connect chain, with diet, with movement. I think I said movement already. With anything. Some of it is really easy. Some of it's a little bit more difficult. I'm going to talk about a little bit of them in here today. So guidelines, so as pretty much any kind of professional in the field of kinesiology, unless you are approved to do something, don't meddle with it. Okay. For example, diagnose medical conditions. Okay. Obtain exercise or health guidelines from a physician, physical therapist, general dietitian, and so forth. Okay. So don't diagnose anything. You can be like, you know what, it kind of looks like this, but don't say, you know what, that is what that is. I'm an athletic trainer. We are allowed underneath the physician to do some diagnostic tests and outcomes and stuff like that. But even stuff that's outside my realm, I won't touch. Even though, you know what, that looks like diabetes. You have the signs, symptoms. You should go get that checked, kind of thing. Same thing. You should not prescribe treatment. Okay. You should, if in doubt, just refer. Long story short. If it's not what it should be, refer them, kind of thing. Prescribe diets or recommend specific supplements, unless qualified. Okay, unless you're a nutritionist, don't prescribe a diet. You can do recommendations to a specific, I recommend that you cut out this or that. But I'm like, you should take this supplement or that. Then you're getting yourself in trouble. Because then if they have a kind of weird reaction, even if it's mild or severe, they can come back and sue you for that. Even though we're going to talk about diets here in the next few weeks or so, I'm going to give you some general key points to have you recommend people or yourself or family or so forth. You should not provide treatment of any kind for injury or disease unless you're qualified to. For example, basic first aid. Okay, so if you are certified in CPR or AED first aid, then you can provide first aid because that falls under your scope of practice. But if it is outside your scope of practice, you shouldn't do it. Okay. And again, refer on that. Provide rehab services for clients. Unless you are trained and certified in some form of rehab or rehabilitation, you shouldn't do that. Here in the future, I'll talk about some rehab stuff to do, and that's not really to have people do those, have you prescribe them, but I'm you know what, let's say these are good exercises to do, especially if you're going to anticipate this. If you're going to have hip surgery or they had hip surgery, you know what, maybe you shouldn't put them on an upright bike. You should put them on a recumbent bike. Okay, that's easier for the hip joint. Or if you want to really protect the knee against some ACL stuff, okay, these are exercises you really want to focus on. So for example, if we're looking at that athletic population, okay. And last thing, you should not provide counseling services for clients. You're not any kind of coach or psychologist. Don't do any of that. But it means you can be there and listen to them. But I wouldn't give life advice or financial or anything like that. Okay, you're just asking for trouble. I know. Fitness assessment components. Okay, so use a variety of observational methods to obtain a balanced overview of clients. Talk about some subjective and objective. So the subjective is going to be the general medical history. And then objective, it could be psychological assessment, body comp, cardiorespiratory, static and dynamic posture assessments, and performance assessments. Do you not want to hear this anymore? So subjective information is everything that they tell you. Okay, that's all going to be subjective, and objective is going to be anything that you can measure. Okay, let's know that that's the big difference between the two. Okay, more about subjective. Okay, gathering from a prospective client to give a fitness professional feedback regarding personal history, such as occupational, lifestyle, and medical background. So one of the easiest forms of gathering information is through a questionnaire. Questionnaire is really, really good, really, really valuable to do. And then we're talking about the PAR-Q, the Fitness Activity Readiness Questionnaire. There's tons and millions of questionnaires. If you're trying to go the physical therapist route, insurance really requires a lot of these questionnaires, especially like what's your quality of life? What do you perceive your quality of life to be right now versus 6 months ago? And then you're going to do all these kind of questionnaires or administer them to your patient, for example, every so many visits, months at the end of the visits, and so forth. For one, you need it for insurance purposes. And it's also really good data tracking. Okay. Are they more confident with their treatment? Do they feel like they're getting better? That's a big aspect of it. Okay, regardless, whatever you can measure on them, do they feel like they're getting better? That's the mental aspect, and that's really, really important. So general history. Okay, so ask some very basic questions concerning client's history, personal background. You can obtain a wealth of knowledge. It's like occupation. So what do they do for a living? Okay, does your occupation require extended periods of sitting? For example, like even during COVID times, what do you do throughout most of the day? Do you sit and watch TV? Do you go on walks? Are you active? Are you still going into work? What are you doing? Okay. Does your occupation require extended periods of repetitive movement? Okay, whatever that may be. Okay, and give them time to think about this. This is usually a paper that you give them. That way they can kind of like think about it. Does your occupation require you to wear shoes with a heel? Maybe it's dress shoes, maybe a specific shoe for that profession. Does your occupation mentally stressful? Cause a lot of anxiety, which is very, very common. Okay. And then what type of anxiety? And then it's one of those like, okay, you have a lot of anxiety. Okay, maybe to help out along with anything that we do, you should see a psychologist. For example, anxiety, let's say we're working with someone on campus. Okay. Or maybe you have a lot of anxiety yourself. I mean, mental services, psych services on campus is amazing. Okay. There's a lot of, what's the word? Hesitation from a lot of people. I'm like, oh, I'm not crazy. I'm not saying you're crazy, but they can help give you certain like tools and kind of exercises that you can do to help out with your anxiety. And it can help a lot. And what's the worst thing that happens? You spend a few visits and you talk to someone about it. Okay. Next would be lifestyle. Okay. What's your recreations? What's your hobbies? Okay. Maybe something that you do often or something you really like to do more often. Next would be medical history. So this can be really simple. This can also be really, really complex. So find out a client's medical history to obtain information about life-threatening or chronic diseases, as well as structural and functional health. Okay, so past injuries. Okay, really, really important. Like how many ankle sprains did they have? Okay, past surgeries, chronic conditions, and medications. So for like past injuries, let's go a bit more in depth. Like, okay, I've had some past injuries. Okay, I've had ankle sprains. How many? Was it all one ankle, or was it both? So forth. Was one really, really bad? And then you might dig in a little bit deeper. Like, I've had 7 ankle sprains, but only on my left ankle. Okay, I'm like, okay, why is that? Okay, what does that do with sports? Like, let's say you're right-footed and you play soccer, and that it's all on your left ankle because that's your plant leg. Okay, I can explain a lot, but then you got to keep in mind. I know. how is that going to affect their movement patterns? And then when you do other assessments later on, you can kind of see maybe that plays a factor, hopefully not, but usually does. Also, past surgeries. Did they have a cesarean surgery? Knee replacement, so forth. Some surgeries have a lot of contraindications, even long-term wise. Let's say if you have hip replacement surgery, well, you're not going to be able to do much beyond bodyweight squats, for example. You're not going to load up a bar with 225 pounds and start squatting. Okay, that's a contraindication for that hip joint. And a lot of those. Chronic conditions, okay? Do you have any chronic conditions like currently? Is there anyone in your family? There's heart disease, type 1 diabetes, so forth. And what medications are you on? Okay? Like currently taking. And then what have you taken in the past that's really like affected you? Okay. Next would be a sample history. I don't believe I talk about this much beyond this. And that's an easy way. It's going to be, this is just help you remember stuff. So signs, symptoms, okay. What happens? Hey, I'm going to come back. I got to change the diaper. Sorry, baby. Problems. Okay, so back to the sample history. Okay, so again, the S is signs and symptoms. Okay, so what are they experiencing? What are they feeling? And both of those can be subjective or objective. Okay. Then there's the A. Why am I drawing a blank? Allergies, sorry. Allergies, what allergies do they have? A common one is latex. So whatever setting it is, it's good to know if they have a latex allergy, because more things than you would think have latex in them. And there's also bees and some of the rare ones like watermelon, melons, and nuts is always a common one. So stuff just keep in mind. M is medications. Okay, so what medications are they on or have previously been on? That's just important to know. Okay, so for example, if they're on a blood thinner, that's good to know. If they're on anything for diabetics, like insulin, for example, inhalers, good to know, because you always want to keep like inhalers on hand with them. If someone just shows up for whatever, like sport activity, workouts, make sure they have their inhaler. P is past history. So what have they had in the past? Have they had ankle sprains, hip flexor strains, just general muscle strains in general? What have they had? L is last oral intake. This is only really important if it's like injury related and they need to have like surgery, like emergency surgery, or they're taken away or something. Then they need to know if they need to like pump their stomach to get everything out of there or whatnot. And then E is events leading up. So did they trip and fall that morning and then complaining of headaches later on, or they had a car accident a few days ago and they're really sore and that kind of stuff. So a lot of times sample history can be really, really simple. And this is usually only if they're like experiencing something. So let's say that you're doing a workout and they're really, really lightheaded. And then you like might go through, okay, what are your signs and symptoms? Okay, you know, I'm really, really lightheaded. And I'm really thirsty. Okay. And then do you have any allergies? No. Taking medications? No, not really. Has this ever happened before? No. When did you eat last? Oh, I didn't eat today. You do anything weird happened this morning or earlier today? No. All right. So maybe they're a little dehydrated. Maybe they need to eat something. Okay, just off of that. Objective information. Okay, so gathered to provide a fitness professional with forms of measurable information. Can be used to compare beginning numbers to those measures weeks, months, or years later to show some kind of improvement or deficit, as well as like effectiveness. Okay, so there's psychological assessments, body comps, cardiorespiratory, posture, movement, and performance. So physiologic assessments provides valuable information regarding the status of the client's health, common ones is heart rate and blood pressure. And usually when it's heart rate, it's usually a resting heart rate. That's usually taken in the morning, literally before they get out of bed. So one thing that you can do is, before you get out of bed in the morning, is to just take your pulse. That's just the heart rate. And that usually shows you what your resting heart rate is normally, before you do anything, before you can go to the bathroom and whatnot. And then blood pressure, obviously a little bit harder to do yourself unless you have an automatic cuff or someone that can do it for you. And going back to heart rate real quick, usually the better shape you are, the lower your heart rate is, because the less your heart has to work, because it's more efficient. So here's a quick way to measure heart rate. So the radial pulse is the ideal spot to take, especially on yourself. So I believe the book says take it for 6 seconds and multiply it by 10. I think that is a horrible way of taking it personally, just because you can miss a lot of things, like how's the rate, the tempo, the characteristics of it. You kind of lose that because 6 seconds is not really a good amount of time. Especially if it's like a resting, because it's usually a bit harder to find. An active individual finding a pulse is usually really, really easy, and sometimes you can almost see the bouncing on the skin. So for the radial pulse is always with a thumb, and it's good. You could take it roughly about right in here, not directly out on the side, but just on inside, kind of a little bit on that palmar side. Okay. In order to use 2 fingers, don't use your thumb to take a pulse, because your thumb has its own pretty major artery in it that you could possibly feel your own pulse as well. So deep in this kind of little crevice right here is where we're going to find the radial pulse. That's the ideal spot to find it. So you can either take it for a full 60 seconds, or you can take it for 30 seconds and multiply it by 2. The 30 multiplied by 2 is the preferred way. The full 60 seconds is really just kind of a waste of time in a way. But 30 seconds, you're going to feel, for one, the count. And you always want to have usually some kind of watch with you. That way you can measure out. You're looking like, okay, you're going to need a second hand usually. And you're going to follow. Okay. You're going to feel, is it like a thready, or is it more like a pounding force? Is it constant? Is it the normal, like that's your rhythm? Or is there like a kind of thing where like skips a beat or something weird pulse? That's good to know. Not really common to find one. Usually they're pretty constant pulse. But a little crazy when you first feel your first irregular pulse. The carotid pulse is not really, I mean, it's a good one to take, but it's a little awkward to take on someone else, especially if they're conscious. The carotid pulse is the preferred one to take if someone is unconscious, just because that's good. It's a bigger artery than the radial pulse. And that one's located in the neck. You never want to cross the neck. You always want to go on the same side of the person that you're doing it on. Crossing the neck is really what's the word I'm looking for? It's a poor habit, but it's, this is wrong. Just go with wrong. Okay. You always want to go to the same side. And what you're looking for is there's a muscle you can barely see it here on the PowerPoint. That's here on the side. So it runs down here. It's called the sternocleidomastoid. Okay. And what you're going to do is you're going to pull that muscle to the side a little bit from the front, and that really exposes the carotid artery. So again, it's going to be 30 seconds multiplied by 2. Average resting heart rate is kind of between, 60 and 80? Give or take the book you look at. Some is 80 to 100 and so forth. So about 60 to 80 is your average resting heart rate. They give you those rates there, but those more just kind of averages. But you're going to find this within a range. Now, given this is resting, when you're active, your heart rate can exceed 120 pretty easily. So training the heart rate, okay, so it's a good calculation to help you kind of like assess the heart rate zone for the cardiorespiratory exercise. So you find the estimated maximal heart rate. It's usually 220 minus your age, whatever it is. Okay, and you're going to multiply the estimated maximum heart rate by the appropriate intensities. Okay, so if you want 65%, you want 90%, wherever it is. So zone 1, they're going to use some zones here in a little bit. Zone 1, the maximal heart rate you want is about 65. Okay. Zone 2, the maximal heart rate is going to be about 76. Okay, that's a little range. Like zone 1, 65 to 75. Sorry, and zone 2 is 76 to 85. Okay, and zone 3 is going to be 86 to 95. So you can multiply both of those. So your max heart rate, so 220 minus your age. Okay, so if you're 20 years old, your max heart rate's 200. Okay, so 200 minus 65, that's the minimal for zone 1, and then you're going to multiply it again, 200 by 0.75 to get your maximum. So if you're training for zone 1, you don't want to exceed that 75% capacity. So this kind of give you a good idea. So heart rate reserve. Okay, so heart rate and oxygen uptake are pretty linear. So they're pretty much like dependent on one another. During dynamic exercise, selecting a predetermined training or target heart rate based on the given percentage of oxygen consumption is the most common method and universally accepted. So your heart rate reserve is your max heart rate minus your resting heart rate times your desired intensity plus your heart rate. That's just your heart rate reserve. Blood pressure. So blood pressure, obviously you're going to need the blood pressure cuff and stethoscope for this. When we talk about the numbers on the blood pressure, the normal is like 120/80. So the 120, that top number is your systolic, and the bottom number is your diastolic. So the systolic blood pressure is the pressure within your arteries and your heart when your heart contracts. Okay, and then the diastolic is the pressure in your heart and arteries when your heart is in a relaxed state. So that relaxed state is important because that is allowing your heart to fill back up with blood before it pumps it back out again. Okay. So usually, like, you're going to have a difference. Your systolic and diastolic shouldn't be anywhere within 30 millimeters per mercury of each other. And so you use a sphygmomanometer, blood pressure cuff, and then a stethoscope for this. So procedure, I mean, if you're going to take a blood pressure, really the best thing to do is to practice. It's a little difficult initially to kind of grasp some of the concepts of taking it. And then once you got it down, it's usually pretty easy. Okay. So the first thing you're going to do, instruct the client, whoever you're doing it is, to assume a comfortable seated position and place the approximate size cuff just above the elbow. Rest the arm on a supported chair or support the client's arm using yours and place a stethoscope over the brachial artery using a minimal amount of pressure. Just to be add a little bit more critique to this, make sure they're sitting in a chair. Make sure their feet are flat on the ground. They're not crossed or anything weird way. Make sure they're sitting upright, leaning all the way back, kind of relaxed. Their arms should be roughly about the level of their heart, okay, elevated. You're going to put the sphygmomanometer or blood pressure cuff, okay, on the upper arm, okay. Usually a bit higher the better than lower. And you want the palm fully supinated, okay. And this is where you want them to be. You want them relaxed. You also make sure that they haven't taken like energy drinks or pre-workout or coffee, probably within like 2 or 3 hours of doing it. Otherwise, that's going to affect your results a tremendous amount. And then you put the cuff on, just snug. You don't have to put it on like really tight or anything because you're going to pump it up and it'll get really tight then. Also make sure that you have the appropriately sized cuff for the individual. For example, I'm an adult large, or usually just an adult. The bigger size arms are going to need maybe a thigh cuff or an extra large cuff. There are also blood pressure cuffs that go on smaller individuals, maybe like a really thin arm or a child. And if you use the wrong size cuff, it's going to affect your results a lot. Okay, it's pretty much not going to be valid. Okay, let's say rapidly inflate the cuff to 20 to 30 millimeters per mercury above the point where the pulse can no longer be felt. honestly, you're going to pump it up to about 200 millimeters per mercury. Okay, that just pump it up to there. Especially for general populations, just pump it up to 200. Okay, then you're going to release the pressure at a rate of 2 millimeters per mercury per second. Okay, listening for sounds. Okay, so 2 millimeters per mercury when you're listening to pressure is very, very slow. This is usually people screw up the most on. So people think, oh, it goes like pretty much like at that speed. No, it goes at this speed right here. This is 2 millimeters per mercury. Okay, and then I'm going to be going a little fast. If you ever look at the actual blood pressure cuff on the dial, each line is 2 millimeters per mercury. Okay, it's not one, it's two. And they're really, really close together. So, I mean, it's a really slow thing. And when you're releasing, you got to release usually with one hand because your other hand's holding the stethoscope. And so when you first start hearing the pulse come on, okay, so we kind of faint, that is going to be your systolic pressure. So then you got to record that number in your head. It's like, let's say it's like 128, okay? And then it's going to start off really light. And then as you keep releasing, it's going to get louder. And then when it completely disappears again, that is your diastolic. Okay, so then you record that number in your head and then you write it down. That's going to be roughly around the 80 range. Your systolic changes a good amount depending on mental stress, activity, anything. It's pretty easily changed, but your diastolic is usually not. Your diastolic can change through activity, but it's usually over a long period of time. So just go over it again. So okay, put the cuff on, have them seat correctly, feet on the ground, okay, arm about heart level, and relaxed. Okay, don't have them hold it up. Okay, it has to be relaxed. Put the cuff on, put the stethoscope over the brachial artery. So it's going to be roughly, the brachial artery runs just under the bicep here. Okay, so I want the cuff roughly about right here. Okay, that's an ideal spot for it. Okay, I'm going to pump up to 200. Then I'm going to decrease it, okay, at the rate of 2 millimeters per second, which is pretty slow. And when I first hear that heartbeat, I'm going to record that in my head. And then when I don't hear it anymore, that I'm going to record that, and then you have my systolic or the diastolic. It's also really important to have the room pretty quiet, especially when you're first learning it. It's really hard. You really have to really pay attention to what it is, because if there's a lot of background noise, it's really, really hard to take a blood pressure, especially appropriately. So if you ever get a chance to actually practice it out, I highly recommend it. Maybe if this class goes in person again, we can practice this a little bit. All right, next we have body comp. There's a variety of methods used to estimate body composition. They vary in cost, accuracy, and skill. Okay, so the three I'll talk about is going to be the skin folds, biological impedance, and hydrostatic weight. There's actually another one that I'll mention in here, but the first one's going to be skin fold. So you measure the skin fold thickness at varying spots around the body. I think we're going to go over that here in the next few slides. Next one's going to be bioelectrical impedance. This measures resistance to electrical current. Next one's going to be hydrostatic weight. So this measures body density by measuring buoyancy. The hydrostatic weight is really, really nice. I believe that one is the golden standard for checking body composition. The downsides of hydrostatic weight is, one, you're in water. So usually you have to get in water, and they have to do a few measurements beforehand, like weight and like height and so forth. And then you go, you're sitting in like a bathtub, and then you blow all the air out of your lungs as you go underwater. And then that's good. But the more air you push out of your lungs, the better. So you're almost choking. Like you can set up really quick, but you got to put all your body underwater to do this. So usually it's pretty hard to do this, especially if you have like an older person or someone that's really like claustrophobic or scared of water. So that's a really big downside of that. Another downside is the cost of doing this. Usually you can like just pay and do it. I think Fresno State charges like $25 to do it in their lab. But I mean, you're not going to buy your own hydrostatic whey just because it's pretty pricey. And we're in the thousands of dollars at least. Actually, probably more like upwards of $10,000 just for this. It's not a small thing, but it's probably the best way. Another way, it's not hydrostatic whey, but it measures, instead of the kind of buoyancy, it's the air displacement, and that's a bod pod. And if I can, I'm going to try and attach a little video in here. So Fresno State, I know, has one. And then Clovis North has one. I know Clovis North has one is because my wife has it. It's her class, and that's what she uses it for. So it's this egg-looking container to where you put your height and weight, and like as a scale that you weigh yourself in, and then you go in this little egg, and it takes a few minutes to do. And you just don't move. You breathe normal, and then it detects the air displacement in there. And it can determine your fat-free mass and how many pounds of lean body fat you have, and percentages, and even lung volume. Pretty cool. But again, she got it for like a discount of $80,000. With that, and that was with a discount because it was pre-used by some university East Coast that needed a higher class version of it. So they're just trying to trade it out real quick. So again, that's one really nice thing, but I mean, cost is a little up there. But usually like Fresno State and like Clovis North, like they do it for like $20, somewhere around there. You can get it done. And then I think we're talking about the biological impedance and the skin fold here in a minute. All right, so some benefits of body comp testing include health risks. I can tell you if you have like excessive or low body fat, understanding of body fat, monitoring changes in the body composition, help kind of estimate like a healthy body weight for that individual, and can assist in like exercise and program design, depending on like their goals and stuff like that. All right, so skin fold. Effective for trainers, whether you're personal trainers or athletic trainers or whoever it is, without a lab at your disposal. So indirect measure of adipose tissue through thickness of skin. So adipose tissue is just fat. That's just the scientific name for fat. I take a minimal of 2 measurements at each site. I like to do 3 different passes personally. Accurate when locating landmarks. Do not measure after exercise, and not effective on extremely obese clients. Let me see. They also have to be hydrated. For example, skin fold is pretty common with wrestlers. Just because it's pretty cheap, almost everyone can do it. You take it at roughly about 4 sites. So bicep, tricep, subscap, and iliac crest. So, for example, the bicep, okay, you do a vertical fold on the front of the arm over the bicep muscle, halfway between the shoulder and the elbow, okay, so right in the muscle belly. But one thing that's really hard on the skin calipers is it's a lot of practice to really be really good at doing this. It took me a good amount of time to practice all this because you have to pinch the skin so right to just get really kind of like the skin and not really muscle. And then like be some of the fat that goes along with there. You got to feel a little bit between how muscle feels versus how other like adipose tissue feels, or if there's scar tissue or whatnot in there. Okay, and then you're gonna put it between this skin caliper as you see here in the picture, and they run about $120, $150 each. They're very, very sensitive, and every so often you do have to get them calibrated. But it's only if you're like measuring for a specific like reason, like research or any whatnot, does it really have to be calibrated more often. And this would be the tricep. Okay, again, a vertical fold on the back of the upper arm with the arm relaxed and held freely at the side, halfway between the shoulder and the elbow. Okay. The subscap. Okay, so a 45-degree angle. Okay, 1 to 2 centimeters below the inferior angle of the scapula. So your shoulder blade, you're going to feel your shoulder blade about pop out like right here. It comes down to a little bit of a point. So you got to feel that and you got to grab a little below that at that angle for that subscapular one. And also going to be your iliac crest. Okay, so at a 45 degree angle just above the iliac crest and medial to the axillary line. Okay, the iliac crest is kind of like that. Your hip comes up on your side. It's going to be higher than your waistline, as you see in the picture. So calculating your body fat percentages. So after the 4 sites have been measured, so what I'll do is I'll do 3 rounds of this. And I'll myself write down, or I'll have someone else write down for me. So I'll take it once in that spot, and I'll have it write down, and then I'll take it again, and I'll let go, and I'll take it again, and write down, and I'll take it again, and write down. Okay. So for me, I like to take the average of that, unless I have like one number that's really out there. Let's say my first one was really off. I got like 18. And then my next one was like 7. Like, okay, I'm going to throw out the 18 just because it's really out there. That's why you want to do at least three runs of each one. So then I'll take an average of all those. If you're really, really lazy, you can just do 1 round. Okay, you add them up, and you use a table in the textbook. Let me pull that up real quick. So if you look on page 124 and 125, it'll show you the big chart. I'm not going to put it in my PowerPoint just because it's a pretty big chart. If you look and see, it takes up both sides. So once you get the sum of all those 4 sites, or the average of all that, you go look under the sum of the folds on the left side, and then also you can compare that with is it male or female? Okay, to tell you which one you look at, and then you're going to kind of look down and see which one where you sit at. Okay, pretty easy. So for collegiate wrestling here at City, what we have to do is we have to do the skin fold calipers, and then we have to plug it into a system for the 3C2A. It's like the NC2A, but the governing body for wrestlers, and that helps it so those wrestlers can drop down to a certain percentage of body fat safely. So they can't wrestle any lower than that. That way, like, they're not completely dehydrating themselves and starving themselves more so than they already do, so that they're not endangering themselves. Because a lot of these people, especially wrestlers, can drop down really, really low. One other thing I'll talk about, so I mentioned the bioelectric impedance. So that one is going to be some kind of electrical unit to where you stand on, hold on, wherever it is, and it measures the amount of body fat you have or lean muscle mass, and it also compares it to like your body weight and stuff like that. There's good and bad things about the bioelectrical impedance. They can be really cheap, but they can be really off, because it's going to, for one, on the bioelectrical impedance and the skin calipers, the individual has to be hydrated. So for like wrestlers, we have to really make sure we hydrate them well ahead of time, is we actually have to have them pee in a cup, and we have to measure their specific gravity. I'm not saying that you always have to do this. You got to make sure that person is just well hydrated before you do this. Make sure like their urine is clear to light yellow. That just shows hydration. And then we'll do it. But the bioelectrical impedance, so it says a electronic signal through your body. You don't feel anything, but it travels the path of least resistance. So like the really cheap ones are the ones you hold in your hands. Okay, so the path of least resistance is not going to go all through your body. It's going to go in one hand and then back out the other to the other side. And so we're going to measure pretty much what's in your upper body, which isn't the most accurate way. There's other ones that you actually stand on like some kind of plate, and then you hold something. Those are a little bit more accurate. I don't know the cost of those on the top of my head for that. But that's what bioelectrical impedance is. All right, and then another one is measuring circumference. So those can help give feedback, especially someone that's really their goal is more towards like looks, body alterations. That's going to be the competition, like bodybuilders and stuff like that. Measurements can also be really good to give them feedback on growth. Okay, usually muscle growth. And you usually want to take them on the same side, so you know. So like the neck, you can take it roughly at the Adam's apple. Okay, make sure they're not flexing, just have them relax. It's a relaxing one. So that's the neck. I mean, you can use a cloth tape measure for all these. The chest, okay, across the nipple line. Usually upper chest for women. The waist, the narrowest point of the waist, below the rib cage, just above the top of the hip bones. The hips, you want feet together, and you're going to right on the widest portion of the butt. Thigh, about 10 inches above the top of the patella. But for most things, especially the thigh, you want to just make sure it's in the same spot. So if you're taking this, make sure you document it, obviously. You would do this usually at the beginning of working with a client. And so you just make sure that you dictate, all right, I'm 10 inches above the patella. Or you do right in the middle, but make sure you document it where you're at. That way you can come back later and it's the same measurement. Calf, okay. Maximal circumference between the knee and the ankle. It's going to be more towards the knee, just so you know. That's where the gastrocnemius, your calf muscle, is the thickest. Okay, around that muscle belly. Then there's waist to hip ratio. So a correlation between chronic disease and fat storage in the midsection. So measure the smallest part of the waist without instructing the client to draw the abdomen in, so without them sucking in. Measure the largest part of their hips. Compute the waist to hip ratio by dividing the waist measurements by the hip measurements. So a ratio higher than 0.8 for females and 0.9 for males may put people at risk for a number of diseases. Next one is BMI, body mass index. This assesses weight relative to height, divides body weights by height, pretty much what it is. Obesity-related health problems increase when a person's BMI exceeds 25. There's issues with BMI, just know that. So there's different calculations there, however you want to do it. Some issues are, it goes by weight and height. Okay, height doesn't really change. Weight can. Also, it doesn't dictate what type of weight we're talking about. This is just total weight. So this is fat and muscle mass. So let's say you have a person that is has a ton of muscle on them, for example. Okay, and they're really, really lean. Well, muscle weighs more than fat. So that could dictate that they're actually obese when they're not. Just because they have such a high percentage of muscle on them that they're heavier, and that just throws off their ratio. So just keep that in mind. So the BMI isn't the best indicator. It's a cheap indicator that can help you assess that, but that's it. Just keep that in mind. All right, cardiorespiratory. Okay, so it provides valuable information regarding cardiorespiratory efficiency and overall conditioning. Provides a starting point for cardiorespiratory training zone specific to their physical condition and goal. So here's the two common ones: is the step test and then the Rockport walk test. And then let me pause real. All right, so next we're talking about is the step test. Okay, so the first thing you want to do is you're going to determine whoever you're working with, your patient's maximal heart rate, and then subtract that by 220. Okay, sorry. Your age, 220 minus your age to get your max heart rate. Okay. Then you're going to take your max heart rate and multiply it by the following figures to determine the heart rate ranges. Okay. So again, if you're 20 years old, it's going to be 200. Multiply it by whatever it is, 0.65 and then 0.75. So that's going to be your range for zone 1 and then 2 and 3 respectively. Okay. So I'm actually going to, I believe I'm going to make that into one of the assignments this week. Usually actually going to do the step test and then the Rockport test, which we'll talk about here in a minute. Okay, so the step test, also the YMCA 3-minute step test. So you're going to do this. Okay, and you're going to record it. Okay, so you're performed a 3-minute step test by having a client or yourself do a 24 steps per minute on a 12-inch step for 3 minutes. So you're going to do 96 steps total, just up and down. Then you're going to measure the client's pulse for 60 seconds and record the number as the recovery pulse. All right, you'll look at the score in the chart provided in your text. Okay, so that's going to be on page 130 and 131 for a little bit. Okay, so all you need is pretty much your phone. You need some kind of like metronome that can help you like keep pace, because you want to do 24 steps per minute, which is slower than you think. So if I was going to play it, up, down, up, down. That's it. It's a pretty slow pace. Okay, so that's the tempo you're doing. Okay, let's do 3 minutes of that. And then you're going to record what it is, and you're going to put it, find whatever zone you're in. Okay, and you're going to put it in on the grid, and you're going to assess what that is. So if we were to watch that, I'll show you what it is.
3-minute step test. The purpose of this preliminary screening tool is to make recovery during a 1-minute period following 3 minutes of stepping. The step test must be administered prior to the fitness assessment. Candidate steps up and down at 24 cycles a minute for 3 minutes onto a 12-inch wooden bench. Immediately after 3 minutes of stepping, the candidate sits down on the bench. A 60-second heart rate is taken starting 5 seconds after completion of stepping. Pulse will be taken by another candidate. If the candidate does not complete the test, the candidate will be referred to their physician and will not proceed to the fitness assessment.
So that is it. So I'm going to have this be one of the assignments. I'm going to make this here shortly. So you're going to do that. Okay, not too difficult. If you don't feel like you're good to do it, by all means, do someone you live with. Have them do it. Try it out. Okay. And then once you get the results, it's going to determine your appropriate starting program. Okay. So if you're in like zone like 1, okay, you're poor to fair, and you're zone 2, you're average to good, and you're in zone 3, you're very good. Okay. That's what it finds. And then that same chart is in the book as well. Next is the Rockport walk test. So again, you're going to determine the client's maximal heart rate by subtracting 220 minus their age. And you're going to do the same thing as we did for the 3 minutes step test. Okay, so for the walk test, you record the client's weight and perform the assessment. Okay, so have the client walk 1 mile as fast as he or she can. Treadmill is probably best, just because it's pretty accurate for the most part. Unless you got a track, you can do this one as well. Record the time it takes the client to complete the walk. Immediately record the client's heart rate, beats per minute, at the 1 mile mark. Use the formula listed in the textbook to calculate the VO2 score. It's a pretty, I won't say complicated formula, but it's just kind of long. So you take a certain number, then you have to multiply like your weight by a number, then your age by a different number, and then your gender, and then time, and so forth. And that obviously gives you your VO2 score. Okay. So I'm probably going to put this one as well as an assignment in here. I'll maybe choose one or the other, just because not everyone's going to have access to like a treadmill or a track or so forth. But if not, you can do the 3-minute step test. One or the other. So then you're determine your appropriate starting program based on which zone you're in. Okay. And then it can also tell you your VO2 score as well, and that is in your book as well. That's on page 132. All right. Next is going to be posture and movement. So every movement needs a base for which it generates, okay, your force. Posture is very, very important. Posture is the alignment and function of all components of the human movement system at any given movement or moment. Allows for proper neuromuscular function and optimal movement patterns. Proper posture ensures that the muscles of the body are optimally aligned and the proper length tension relationships. Neuromuscular efficiency is the ability of the nervous system to properly recruit all muscles in all planes of motion. So without proper posture alignment, we set the body up for a series of traumas known as postural distortion patterns. So this is one way that we use. This is what they use called a plumb line. And it's kind of an old school thing. Not many people do it as much. You can also do it with a grid. So what they do is they literally hang a rope or something from the ceiling, and they put a little weight in the bottom, whatever it is. And then the person stands behind it facing one way, and then you're trying to identify different kind of patterns. So the line should go just at the back portion of the ears to like the tip of the shoulders. And then it goes right down through just behind the patellas and then right through the medial malleolus. Okay, so not everyone's perfect, just know that. But a lot of times these postures can get really, really out of whack. And it's also really hard for people to maintain a good posture, especially because we're really lazy. Not everyone, but most of us are. I'm not really an exception to the rule in this, of how we sit, how we stand. Do we slouch? Do we sit up straight? One really easy way you can assess a few things is stand up right now. Let's let your hands dangle at your sides. Okay. Now look where your hands are. Are they more kind of in front and they are against like the front of your body, or are they more at your sides? They should be at your sides. If I can move my dog out of the way. Move it, go. Okay. So if we're standing up, okay, and if we're like this, our hands dangling, our hands should not be here. They should be at our sides. The easy way to do that is if we just stand straight and pull our shoulders back, our hands now go directly at my side. Okay? And that's where we should be naturally. Okay, that opens up our chest. That can allow us to breathe better. That puts our shoulders at a more ideal spot for movement and eliminates a lot of potential injury associated with especially repetitive overhead movements, because almost every sport has some kind of overhead movement component to it. Muscle imbalances can be pretty common in a condition in which a length of the muscle is altered at the joint. So poor posture, repetitive movement, lack of daily movement are considered contributing factors. Other things like injury can affect things a lot. We do a lot of imbalances naturally because of like dominance. Okay, it's like I'm left-handed, so usually I have different muscle balances on my left versus right side. Maybe it's related to sport. For example, if anyone plays tennis in here, tennis athletes, their serving hand is tremendously stronger than they're not. Okay, that's just how it is. To the point of, in terms of like tennis, their bones are even thicker as an adaptation to that increased demand. If you have kids, whatever arm you carry your kids in is stronger. For that's my left, and so forth. And if you have a lot of injuries, a lot of time we'll favor one side versus the other. Just as like maybe we limped for a long period of time, or we're on crutches, or so forth. So predictable patterns of muscle balances that we'll talk about is pronation distortion syndrome and upper and lower cross syndromes. So pronation distortion syndrome is pretty common. And you're going to have this kind of valgus look on your knees. A lot of time this can be, you can see this when an individual is walking. Running at times too, but walking is usually pretty common. Same when they squat. You can see a lot of these. It's pretty common, especially in females, not to diss on females, but females usually have wider hips. And as a result, require more hip control to maintain their lower body. Because their hips are going to be wider than men's. This is how it is. So this is pretty common in females, especially I used to work in high school, and it drive me crazy just seeing everyone walk around because their knees would cave in as they walk, and sometimes run and move and so forth. So the characteristics, the feet are going to flatten. They could have flat feet. They could not. They could have just really, really poor, what's the best way to say it nicely? Poor control. Let's say that, poor control. Okay, so their feet are flat, and a lot of times their feet are going to turn out. Okay, as a result, their knees will kind of adduct and internally rotate. Their gastrocnemius, okay, your calf, upper calf, and then your soleus is your lower calf. Can be really, really tight. Your peroneals, these muscles kind of go along the outside as well. Can also be really, really tight. Your hip adductors, okay, so your groin. Your IT band can also be really tight. The rungs along the lateral outside of your leg. Hip flexors, and then your biceps femoris, which is one of your hamstring muscles. Okay, can also be really, really tight. So a lot of things are tight, honestly. What's weak? Your anterior and posterior tibialis. Those are some of your shin muscles. Your vastus medialis, okay, or VMO. That is one of your quad muscles. That is located right here. Okay. And then your hip external rotators. Oh, sorry, and your gluteus maximus and medius as well. So your butt. And this kind of leads to your knees kind of diving in. You're not very efficient in anything. This can lead to a lot of other issues, especially MCL pain, just medial knee pain in general. Excuse me. Can give you a lot of shin splints as well, just because it doesn't put your lower body in the right position. You see this even more so when they squat down, like when they sit down and stand back up. Their knees dive in. If not, they touch. They shouldn't. They should stay straight over the toes, not be totally dived in. Okay. Next is going to be the lower cross syndrome. So what we're going to have is they're going to have this anterior pelvic tilt, so this excessive arching in their low back. Naturally. Doesn't have to be active, it's or passive, it's just always there. Okay. I like to call it ghetto booty syndrome, okay? Because it make their butt look really, really big when it's really not. Okay. They're going to have tight calves, both your gastrocnemius and soleus. Okay, so your upper calf is your gastrocnemius, and then your lower calf is your soleus. Okay. Really, really tight hip flexors. Okay. Tight adductors, okay, so groin. Tight lats, okay, and erector spinae. So erector spinae is on your back, and the muscle that kind of keeps your body kind of upright, more so. What's weak, okay, your gluteus maximus and medius, okay, so your butt. Anterior tibialis, posterior tibialis, okay, your shins. Transverse abdominis, okay, is like your abs. You can think of that as like your six-pack. And then your internal obliques. Okay, is more kind of on the side, running at a oblique angle. So I can show you something real quick in here. So lower cross syndrome, if I was going to draw a line there, oh, it's not what I want. Let me move this. Okay, so you see both these lines here. Okay, so lower cross syndrome is going to be tight back, tight hip flexor, weak abs, weak glutes and hamstrings. Okay, and that weakness, especially going through like this line here, it's obviously not strong, and it's going to be very loose as well. Versus the tight, it's like the tight low back, so your erector spinae and your lats and all that, and your tight hip flexors. It's going to be pretty tight. Not saying that's overly strong, but it can't elongate. This is a very, very common thing. It also contributes to a lot of lower back pain. Because one of your hip flexor muscles, it's a really, really deep muscle. It's called your Oh, I'm drawing a blank right now. That's a major. Iliopsoas, excuse me. Is your iliacus and your psoas major. It's a combination of the two. And it actually attaches to the front of your spine up here. And it comes straight down and attaches kind of like in front of on your hips in the front. Okay, so if that muscle is really, really tight, it's going to pull your low back forward and give you a lot of low back pain. It's a big contributor to that. Okay, upper cross syndrome usually is pretty easy to see as well. And so they have a protracted kind of rounded shoulders, okay, a forward head, as you see in the picture. Tightness is going to be on the lats, also your latissimus dorsi, pec major and minor, okay, so you're going to have your shoulders forward, okay. Your scalenes run kind of on the sides of your neck. Your teres major and subscapularis, those are those two muscles are, your subscapularis is one of your rotator cuff muscles, and your teres major is also associated with your rotator cuff, but it's not one of your rotator cuff muscles. But also does a lot of internal rotation, so it kind of helps pull that shoulder forward. Levator scapulae, so that is a muscle that attaches your back of your skull down to your scapula or shoulder blade. And then your sternocleidomastoid, which is some of your, that neck muscle in the front. Okay, so that's going to kind of pull your shoulders up and forward, and it's going to take your scapulas kind of roll them forward and kind of do an anterior tilt in them. Not as much as like my fingers are, but instead of being like nice and flattened down, they're going to kind of roll up and up like this. Weakness could be your serratus anterior, your rhomboids. They rhomboids twice. Mid-lower trap, deep cervical flexors, and your infraspinatus, which is another one of your rotator cuff muscles. Just a little bit. Your mid-lower trap and your rhomboids are still a lot of muscles that are very, very important for someone to kind of train, especially that helps really support a lot of that posterior chain musculature. And that really brings, the lower trap is super important, especially for any overhead athlete. Excuse me. That allows for proper shoulder mechanics. Okay. And so we lift your arm up and down. Even though this is really easy, but a lot of repetitive motion with overuse stuff. The lower trap is really, really important for just shoulder health, really in general. And it's really important. It's really easy to train your lower traps, but it's very difficult at the same time because the best way is pull-ups, and everyone hates pull-ups. And it's going to be that last little bit, like right here. I mean, this whole motion is important when you're pulling, but once you're like here, it's this last little bit that you're pulling your shoulders kind of down. That's really going to get those lower traps. Movement observation. Okay, so dynamic posture observations, so like looking at the movement and how they do it, is the quickest way to gain overall impression of the client's functional status. Also good stuff to know is like the squatting, pushing, pulling, and balancing motions as well. It can also be incorporated as a first workout for your client as well. So we're going to go over a few of the movement observations. And I'll probably have this in the next few, I don't know if I'll have it for this week as an assignment, maybe like the next week or so. All right, so the first one is going to be the overhead squat assessment. So this is designed to assess dynamic flexibility on both sides of the body as well as integrated total body strength. So the first thing you're going to do is you're going to have whoever you're doing it on stand with feet shoulder width apart and pointed straight ahead, okay, like this person is here. Let's make it a little bigger so you can see it. Foot and ankle complex should be in neutral position. Have the client raise his or her arms overhead with the elbow fully extended and the upper arm and the shoulders bisect. Okay. One thing I would change from this picture is I would have, instead of their hands forward, I would have their palms face each other. Okay, so it'd be more like this, but directly over their head as they're standing up. Okay, elbows fully extended when they do this. Okay, so that's the start position. Okay, so the movement, okay, start the client to assume a comfortable, controlled squat position and have them repeat it. So easy way to do it is have them just, I'll tell them, keep your arms overhead as good as you can, have them and squat down as far as you can comfortably and come back up again without falling over, honestly. But I'll say squat down like you're sitting in a chair. Okay. So a few different movements. Okay, it's also really good if you record this. Video is better than just photos, so you can see things like dynamically as they happen. Okay, so how did the person compensate is what we're looking for. I don't expect you guys to be perfect in some of these, but the more often you do this, the better you're going to be at it, and you're going to find better things. Okay, so the anterior view. Okay, you can start at the bottom up. Okay, do the feet turn out like they do here? And then what are the knees? Do the knees cave in, or they keep right over the toes? Ideally, you want it right over the toes. Okay, but don't critique them and tell them right off the bat. You can record this in your notes. I don't know if they have this in the book, what to look for. They have a chart for you. It's all right. So you gotta keep note okay, knees dive in. Okay, so now I got this valgus stress as I squat down, or do the feet come out, turn out. Okay, now from the lateral view, okay, you're gonna look at the lumbopelvic hip complex. Okay, big long word. It pretty much looks at the majority of the body for the most part, especially everything in here. Okay, is there excessive forward lean? As you see the picture here, there's a low back arch, like here. Do the arms come down? Ideally, you want the arms straight with the back, and that's going to be parallel to your shins. Okay, that's what you want ideally. Not everyone's going to have that, and that's okay. And it doesn't mean that they get really, really far down, just where they can get comfortably. If they have the excessive forward lean, that can identify things, the rounding of the back as well, and the arms coming down. Let me go back to this real quick. So usually what this is going to identify is weakness and tightness. Okay. So some of the biggest things, so if they're doing the excessive forward lean, which is really, really common, usually what's going to happen is that is a ankle issue. Okay. So as we did last week or week before, we did the muscles in motion, the squat assessment, okay, and how to do a proper squat. So this is what's going to happen to where if they lack a lot of ankle mobility and they can't dorsiflex and bring their knees forward more, body's going to compensate. They're going to bend over more. Okay, so that's really common to this. That's the first thing I would look for is why can't they dorsiflex? And that's going to be an ankle issue. Okay, which you're going to address other things like calf tightness is pretty big because a lot of people have a lot of calf tightness as a result. And that's going to limit the amount of dorsiflexion that they have in the ankle. Okay, if they have the running of the low back, that is a predominantly core stability. Okay, or that can also be an ankle issue, but they can extend their back more than most people can. For example, I can't extend my back like this. Even though she's not overly bad. They just put this line here that way you can identify that. Some will get really bad, but you got to teach them to kind of draw in and tighten their core. And we'll get more about core here in the next few weeks. So that can be mainly a core issue and ankle stuff. Okay. If the arms come down when they squat because they can't keep them up perfectly, that is going to be a tight lats issue predominantly because they can't keep them up, especially when they squat down. Okay. I mean, it gets more in depth, but that's some quick and dirty versions of what you're going to look at for that. and just kind of more into this. So let's say you do get your CPT. You can further get the CES, the Corrective Exercise Specialist, where they go really more in depth on some of these. And that's actually a pretty fun course. Like I have my CES. I use it a lot as an athletic trainer especially. Next one's going to be a single leg squat assessment. So designed to assess ankle proprioception, joint strength, and hip joint flexibility or stability. So stand, place one hand on the waist, or sorry, both hands on the waist, focus in an object straight ahead. I'm going to do straight ahead or on the ground, okay, but not like straight down, but more kind of lower. They're going to have more stability this way. Their balance can be a little bit better too. Feet should be pointed straight ahead. Foot, ankle, knee, and lumbo-pelvic hip complex should be in a neutral position. So they're pretty much standing on one leg, hands on their hips, head straight ahead for the most part, and lift one leg off the ground. And that leg's going to be up in front of them, not behind them. Okay. And instruct the client to raise one leg and accept the weight with the opposite leg. Okay, single leg stance. Have them do a single leg squat. Okay, just as far down as they can comfortably come up and down again. Okay, and have them do it about 5 to 10 times if they can. Okay, so this is going to help you identify a lot of things. So the anterior view, you look at, excuse me, the knee. Okay, there's a knee cave in. Okay, it's going to cave in a little bit, and that's okay. But is it a lot of it? That's not good. Okay, the shin should be pretty much perpendicular to the ground. If it caves in a lot like this, that's too much of that kind of valgus force. I want to talk more about it. Also, there's a side view. I don't know why they don't put it in here. It's the same as the double leg squat. The shin should be parallel to the back. And you want to repeat this on both legs. And you're going to see the difference in the two. Okay? Let's say one caves in and the other doesn't. Okay, now you got a muscle imbalance, more so in the calf and groin area. Next one is be a pushing assessment. Okay, so instruct the client to draw abdomen in, feet shoulder width, and toes pointed forward. You're going to have them press forward and slowly return, about 20 reps. So we're looking at excessive running of the low back, or just the back in general. Is the head pointing forward, or like so? Do shoulders elevate? Those are just some things to keep in mind. Okay, they should have a tight core. They should, so no rounding. Their shoulders shouldn't like shrug up as they push. Okay, they should still stick relatively down, and their head shouldn't come forward. Okay, next would be a pulling assessment. Okay, so instruct the client to draw the abdomen in, feet and shoulders apart. And we're going to talk more about the drawing in of the abdomen when we get to like the core, just so you know that. Toes point forward. Okay, so movement, instruct the client to pull handles, if you have this machine, toward the body and slowly return. Perform about 20 reps. Okay, so again, you're looking for the running of the back. Shoulder elevation, and then forward head. Okay, so they shouldn't have any of those. Okay, so your back should be straight, shoulders should be down, and the head should not go forward. If they have any of those, it's usually some kind of weakness. I mean, the running low back, okay, that's core, obviously. Shoulder elevation, that's usually a overdevelopment of the upper traps and weakness of the lower traps. And then the head going forward, that is like the shoulders kind of rounding as they kind of come up. Okay. It's a weakness as well of like the lower trap and other regions. Performance assessments can be used for clients trying to improve athletic performance or just trying to be active. Basic performance assessments include Davies, shark scale, bench press, and leg press. So the Davies test, designed to assess upper extremity agility and stability. So if the person lacks a lot of shoulder stability, maybe this is not the best thing for them to do. So you're going to do is you're going to have a tape where you measure out. You put like 2 pieces of tape on the ground, about, let's say it's like 36 inches apart. Okay, usually good, like standard spot. And have them in a push-up position with hands like split on each tape, and then go back and forth to touch each tape as you see forth. Okay, I do it for 15 seconds. I'm going to do it 3 times, 3 trials. Okay, let's kind of see where they're at. Next to be is the Shark skill test. This is for lower body agility and neuromuscular control. Should be viewed as a progression from the single leg squat. Not suitable for everyone. One, if their balance sucks, maybe work on that first before doing this. Or if they lack a lot of stability or just strength in general to do this. I'm not saying that they have to get in a squat, but they have to be able to like hop. All right, so start position. Have the client in the center box of the grid with hands on hips, standing on one leg. Instruct the client to hop to each box in a designated pattern, always returning to the center box. Be consistent with the pattern that you expect of the client. So whichever one you want to do, you pick your own design. So I mean, it's only 9 squares, so you can go up and back, side to side, in a circle, or counterclockwise, however you want to do it. Just make sure that it's a pretty constant one. Maybe, depending on the individual, maybe start with a simple design and make sure they get it down. Maybe even have them practice a few times before you actually have them do it. And then every time they screw up, you're going to add 0.10 seconds for each of the following faults. So non-hopping leg touches the ground. Hands come off hips. Foot goes into wrong square. Foot does not return to center square. So you're going to add a 1/10 of a second every time they screw up. And also make sure they do it on both legs. Next will be the bench press strength assessment. This will help estimate a 1RM, so 1 rep max. So advanced assessment for strength-specific goals. If you have someone that has never benched before or hasn't benched in a long time, I wouldn't have them doing 1RM right off the bat. I'd have them kind of build up and slowly like increase like their strength, and once they feel pretty confident in that, then you could have them do a 1RM. But then you also have someone spot them as well. So position client on a bench, lying on the back. Feet should be pointed straight ahead on the ground. Lower back should be in neutral position. Don't have that excessive arching in the back like you see in some videos. So have the client warm up with a lightweight for 8 to 10 reps, and the rest of that at least a minute. Add 30 to 40 pounds or 10 to 20% of the initial load, and perform 3 to 5 reps and then a 2-minute break. And repeat the step until a true 1RM max has been achieved. Okay, so until I can't go anymore. Okay, so but 1RM is there's no help from a spotter. Always have a spotter for like the bench press and the squat. Just because you could hurt yourself or worse. But a lot of time I would have them, if this is the first time working out in like years, all right, we're not going to do 1RMs. Maybe about a month in, we'll do a 1RM. Just wants to kind of get a use for things, kind of get some muscle strength, confidence, and so forth. So you get like a true 1RM. And then you're going to have that little feedback from them, because if they're getting close to max, I'm not going to have them add 40 pounds and then not do it. So let's kind of keep that in mind. Next one's going to be a squat assessment. So designed to estimate a 1 rep leg press max. I wouldn't do leg press. I would do just the squat. Okay. Again, not suitable for a lot of people. Other people aren't comfortable with a bar hanging on their backs. Well, they may not be used to it, especially if they haven't done it before. A lot of people may not be able to hold that much weight depending on, let's say they had a hip or knee surgery. They're not supposed to do that. Okay, so position. Okay, position standing of the bar on his or her back, right on the neck. Feet should be pointed straight ahead or slightly out. Knees should go right over the toes. Okay, a low back should be in a neutral position. So have the person perform 3 to 5 reps with perfect form. Chart amount of weight used for accomplished reps. Refer to appendix in textbook for a comparison chart to estimate the 1 RM. You can do, let me see what they have in the textbook for this. They don't even give you a chart for this, unless it's down at the end. But same thing as with the bench press, I wouldn't have them do the 1 rep squat right off the bat. I mean, they have to build up one good amount of core strength. If they don't have that, if they don't have core strength, they're not doing this. Also, they'd be comfortable squatting. So we did the air squat a few weeks ago. So now you have to add the component of weight. So the bar itself is going to be 35 or 45 pounds, depending on which bar you use. Usually they're 45 pounds. And maybe for some people, that's it. It's just a bar. And they have to be able to do that squat with perfect form, so no excessive forward lean and so forth. So it's getting used to it. And getting a good proper squat is really, really important. Before they would do this. And I think the comparison 1 RM they want you to do it's probably in the back of the book, I bet. It's usually just a comparable, let's say they do 135 pounds for like 5 reps. Well, that could be equivalent to 180 pounds of a 1 rep max. I'm just throwing the numbers out there. Don't quote me on those exact ones. But that could be something equivalent. But maybe at one point they do get a 1 RM for a squat. That's probably the best way to do it. But you make sure when the form has to be perfect, you have spotters, you have the correct equipment, because a lot of time you may have to bail the weight. Let's say you don't get it. Will you be able to bail the weight so you don't hurt yourself? And that's really, really important to do, because a lot of people don't know how to bail this weight here. Usually you're not going to be standing up, you're going to be squatting down all the way, and let's say you're stuck, you can't go up anymore. Or you bail the weight, so you're going to drop it back. So you're going to move your hands, and you're going to just kind of like throw your back. You can squat down as you do it, and just have the bar just kind of roll down your back or as you hop forward, and honestly enough, it doesn't hit you. It mostly happens to hit you in the butt, and that's it. But also you want to make sure that if you're very new to squats, do it in a cage. If you're in a proper squat cage, by all means, and you set up the safety bars properly, you're not going to hurt yourself, because you bail it and whatever. So you put the safety bars like right here. That way you just drop down and the bar will rest on the safety bars. Great. It's really safe as long as everything's set up correctly, which is pretty easy to do. And that's it. But you have to have confidence in bailing. So maybe it's really important for you to just practice bailing. I mean, start with like a light weight and just practice dropping it. I mean, as weird as that sounds, so you get that confidence that, you know what, I'm stuck and I'm just going to drop it. And that's it. And then just restart. That's all it is. But having a good spotter is good for this. For one, there has to be good communication between the spotter and whoever is doing the exercise, because the spotter can't, a lot of times for a spotter for a squat will help you kind of get back up. So I'll come behind you and I'll put my arms underneath in their armpits, and I'll try to help them kind of squat up. But if they're bailing the bar, it's going to come back on me, on my arms. I don't want that. So that's a good communication for don't help me, but be there if I need help. Or just kind of leave me alone, I'm just going to bail it, kind of thing. And this is more as you kind of get experience and you go through everything is where you're actually going to get full advantage of this. So summary, say fitness assessment enables the fitness professional to decide the appropriate selection of flexibility, cardiorespiratory, core, balance, power, strength for whatever exercise that they're doing. So a lot of this is just be like repetition, like try it out. So if you have access to a bench or a squat, I mean, try it out. What is your 1RM? Okay. Obviously, like have a spotter so no one finds you dead. And what the general rule of thumb is, if you find someone like dead or unconscious while squatting, you add more weight before you call 911. It makes them feel better. That's a joke, but really. Have a spotter. And try some of these out. I mean, try the Shark skill test, the Davies. They even have a push-up assessment in the book as well. I mean, it's just how many push-ups can you do before your form fails. A lot of people can't do a proper push-up because they don't have the core strength to get in that, to maintain that kind of like that plank, if you will. So try out some of these. Okay, see where you're at. Record yourself. Okay, that's the best feedback you can get from that.